message is the reason why we want everybody to support this campaign to flip Virginia's 5th Congressional District, not because of a political party, but because of putting people first. But because of putting the emphasis where it belongs on the needs and concerns of the folks who live here in the 5th Congressional District. Folks down in South Side, folks in Central Virginia, and even the folks who are just outside of DC. We have to find a way to put us first in this conversation. So I'm going to talk to you a little bit about me, my background, so you can tell folks a little more. You can give them a little more depth if they're asking questions. When they tell you, I heard he wants to defund the police, you can be like, that's a lie. Right? We know what they're coming out. As I say, it's a trick of the devil. We know what they're coming with. We know what they're bringing, and we know what we're bringing. I want to make sure you have the real story. You know who I am. You know what I'm about, and ultimately, you know why I'm doing this, why I'm running for Congress, and why I think this is the moment for us to lean into. So we'll start here. There are 3 things I want you to know about me. So, and it's not the fact that I'm a doctor and lawyer and professor at UVA. That's what I do, right? That's how much student debt I got. So that's what I do. But who I am is I'm a kid from Spotsylvania County, Virginia, right? I'm the 3rd of 6 kids, and I grew up in a family that's focused on service. That's who I am. My mom is a public school teacher for 31 years now. 31 years as a public school teacher. My dad works in law enforcement for 20 years for the Drug Enforcement Administration. And we're going to pause on that one for a second. The guy who hates law enforcement's dad was in law enforcement for 20. Not true, right? Trick of the devil. So remember, that's the background that I come from. That's my family. Passionate about service. And I'm the 3rd of 6 kids. And so the first thing I want you to be able to share with everybody is about that being the 3rd of 6 kids. It's that I'm a consensus builder by nature. You can't be a middle child and walk into rooms and think it's all about you. But you also can't walk into rooms and not want to hear the voices that are around you. The voices that are older, that have more agency, that are louder, and the voices that are quieter, don't have as much strength, and sometimes can't speak for themselves. As a middle child, as the 3rd of 6 kids, I learned early that it's important to capture all those voices if we're going to move forward. So first thing is that I'm a consensus builder. Say consensus builder. That's the first thing I want you all to know about me. When you're telling folks who Dr. Webb is, he's a consensus builder, right? And I got that honest. That's something I'm passionate about. And I got to, the other thing I'll tell you about being the 3rd of 6 kids is that it sparked my passion. Because I told you my parents are into public service. And I always said, how am I going to find my way to serve? I found it when I was 4 years old. Because we took a lot of trips to that primary care doctor with 6 kids in the family. And my primary care doctor was a young black man named Timothy Yarbrough. And seeing a black man in a white coat was powerful to me. And they always said, you can't be what you don't see. That's right. And so for me, I said, that's how I want to serve my community. I want to serve as a doctor, as a physician, as a healer. Right? That's really important for me to do. Use that background, that love for science as I grew older and older, using that love for science to help the people around me. That felt like a life well lived. And so what I decided to do was to pursue that passion. Took me to the University of Virginia where I went to college. And in my very first class in college, I learned all about the incredible disparities in our healthcare system. And by that I mean the fact that Black Americans have significantly higher rates of diabetes or heart disease, strokes, HIV, AIDS, infant mortality, maternal deaths, all of that makes no sense, that has no place in a society like the one in which we live. Seeing those numbers, seeing that data, and knowing that it's not because of genes, that's not because of genetics. We've done the Human Genome Project. We know there are more genetic differences within a race than between the races. So it's not about genes. It's about society. Race is a social construct. And I said that if this is our society that's creating these disparities that are killing Black individuals at incredible rates, then we've got to change that, right? We've got to work on that. And I said, I can't just want to be a doctor. I want to be a healer. And sometimes what that requires is that we fight for justice in the spaces that need healing. And that's when I decided I wanted to go a little farther. So the second thing I want you to know about me is I know my true north, and it's equity and justice. All right. Okay? Equity and justice. No matter the issue, I'm always going to be looking for what's fair, what's equitable, what's just. That's what the American dream means to me. It means that everybody has opportunities for health, or everybody has opportunities for success. And so that's something that I'm passionate about. And I remember looking to our past to see how have people done that before. Looking to the civil rights movement. How did they fight for justice in voting rights, or fight for justice in education? They used the law as a tool. And so that's why I decided to go and get my law degree as well. It's not to protect myself from getting sued as a doctor. It helps. But it was because I'm passionate about justice, I'm passionate about health, I want to bring those things together, right? So the first thing about me that you're supposed to tell folks is what? I'm a consensus builder. The second thing is that I'm passionate about equity and justice. That's my true north. So say equity and justice.
Equity and justice.
Okay. I know y'all church folk, that's some call and response. All right, but those two things alone, that won't do it. That won't do it, because I kept moving forward and I was like, well, what else? And the third thing is really important, is that I'm nothing if not action oriented, because a lot of people talk. They talk about problems, they talk about issues, they talk about each other.
That's right. True.
But I'm about action.
Yes.
I'm about getting it done. And the thing is, and actually, my father drove down from Spotsylvania County this morning. He was just hanging out with us in Danville and in Halifax before that. He had to get back up the road, so I'm sorry you just missed him. But one thing that my dad always says, and he told us this growing up, when he worked at the DEA, he would tell his employees, don't bring me a problem. If you're going to bring a problem, bring 2 solutions with it. You laugh. Tell that to a 6-year-old. I was like, So imagine growing up and always saying, yes, I've got this issue, I've got this challenge, but I also have to think through the solutions, think through the strategies, think through how we make this better, right? So for me, that idea of being focused on action, I got that from growing up, and I got that because I want to actually create meaningful change. Consensus builder, focus on equity and justice, and about action. That's the third thing. Some examples, when I was in medical school, I started a student-run free clinic because folks didn't have access to the care they needed. We named the clinic Delivering Equal Access to Care, or DEAC, because Wake Forest's mascot is the Demon Deacons. And we were like, listen, people need access to the care that they deserve, right? They should have access to care, and we're going to help deliver that. I met with the mayor and the city council. I negotiated the contract for the building for $1 a year. That's some good negotiating. I got the prescription drugs for the patients. I coordinated the volunteer physicians. 13 years later, that clinic is one of the biggest draws to Wake Forest School of Medicine. Or when I was in law school, starting something called the Health Justice Project, a medical legal partnership, because sometimes people, you think they've got healthcare needs, but really they got legal needs. Issues with their housing that they need fixed, or issues with public benefits like Medicaid they need help with, right? Sometimes legal services alone. And so working to address the legal needs of our patients, not just talking about the fact you guys have legal needs. No, giving them the services, about the action. Or when I was in residency, I remember as an internal medicine resident, that's my specialty. We have 2 clinics that we get to do during our training. The first is your main primary care clinic. And the second is whatever you choose. It can be cardiology, so the heart doctors, or it could be infectious disease, whatever you want. And for me, I chose community organizing in East Harlem. I did my training in New York City. And the program director said, that's not a clinic, Cameron. But I said, isn't it though, right? Health doesn't happen in hospitals and clinics. You spend a very little bit of your life in a hospital or a clinic. Health happens in communities. It happens in the places where we are born, grow, live, learn, eat, play, and pray. And if we're not spending our time in those spaces to keep people healthy, then we're missing it. We're behind the 8 ball. I said, let me go upstream of the problems, then I can do some good. I used every bit of that law degree. They were like, okay, all right. You can do it, Cameron, you can do it. About the action. So number 1 is I'm a consensus builder, right? Number 1 is what? Number 2 is I'm always about equity and justice. And number 3 is I'm about that action. Those 3 things, that's who I am. That's what I bring to this race. That's what I hope to bring to Congress. And the thing is, when you put those things together, that's what led me to the White House in 2016. I deeply admired President Obama, and for me, I said, this president has done so much to improve the health of my patients. I remember I had an individual in a clinic in 2013 who, in that year, was not able to get the test for diabetes. Some of you know what I'm talking about, that A1C test that you get every 3 months. He couldn't afford it. because the test was $10 and he had to choose between that test or the thyroid test. What kind of healthcare system is that? Where you've got to make those kind of decisions in an annual visit. In the very next year, because of the Medicaid expansion from the Affordable Care Act, that man got all of the tests that he needed. The basic primary care to give him an opportunity to stay healthy. That's what the Affordable Care Act means to me. And that's what it means to so many of you. And that president who made that possible, I said, if I ever have the chance to support that president, I will. So I applied for the White House Fellowship. It's a mid-career, year-long program to work at the highest levels of government. They only pick 15 people a year. And you're working directly with the Secretary of Education or the Secretary of Defense or the Attorney General, not in the basement of some administrative building. You're at the highest levels of government. And I was blessed because I was picked to work in the executive office of the president. I worked on President Obama's White House healthcare team. And I worked on his program called My Brother's Keeper, which was a social justice program to improve life outcomes for boys and young men of color. So there I was working at the intersection of health and social justice. That's the place I like to be. And I saw from that vantage point in the White House, working with 23 federal offices and agencies, I said, this federal government can be doing a lot for the people if we use it for good. If we point all of these resources, all of this know-how, all of this capability toward the needs of the people, we can do a lot. And you see, I fully expected when I went to the White House, because it was a year-long, nonpartisan program, fully expected that I was going to span 2 administrations. And I actually thought I was going to serve both the first black president and the first woman president. But man, it did not work out that way. It did not. But after that election in November, I had a choice to make. I said, do I stick around for this Trump administration that I know things are going to be very different, or do I cut bait and go? Time for me to leave, go somewhere else to do my work. And all I had to do was look inside. And those 3 things you need to know about me. The first is that I'm a consensus builder. Second is that I'm passionate about equity and justice. And third is that I'm always about that action. And so what I said was, listen, if I can't do some good in the Trump administration, nobody can. Then I had a mentor who actually said, you might be the last voice for social justice in this building. And I said, I'm going to take that. I'm going to take that charge, and I'm going to live it. I showed up to work that first day, and they had cleaned out my office and thrown away my things. Oh, my God. And I said, okay, well, so where do you want me to be? Well, actually, they said, we don't want you in the office with us. In fact, there's some desks in the hallway. Just pick one of those. So I said, you know what? I'm gonna let them get used to stuff. I'm gonna go sit at that desk for a little bit. It might take 2 days. 2 days came and went, I was still in that hallway. 2 weeks came and went, I was still in that hallway. 2 months later, I'm still in that hallway, but I showed up every day because I'm tenacious. I showed up every day because I'm never deterred. I showed up every day because I was working for the people, not for that administration, and I showed up every day because they made a big mistake. Their mistake was that they put an extrovert in the hallway. So all I had to do was go around every day and talk to people. Break down walls, break down barriers, pop in on the education policy folks and say, hey, let's talk about school, because public school changed my life, gave me so many opportunities. My mom's been a public school teacher for so long. Now talk to me about this school choice thing. Right, because I can tell you why Horace Mann's vision was that public school was the great equalizer, gave everybody a chance for an education in this America, and I think that's a good thing. Let's have that conversation. Or on healthcare, where they were saying repeal and replace, and I was like, but 20 million people got insurance. I think that's a good thing. Why can't we build on that, right? It's not about who gets credit politically. It's about who keeps us moving forward. We still have 30 million people to cover. Don't move us backward, right? Those are the conversations that we needed to be having. You know, and you've got to call out things when they go well. On criminal justice reform, and this was after my time. Remember, the Trump administration passed, they ultimately signed the First Step Act. That's some criminal justice reform. So we have to be able to say, no, that's good. Do things like that. It's sentencing reform, it's corrections reform, more things like that. But there's more that we need to do, right? And so for me, being an extrovert, walking around that building, talking to people, I learned how to have that tough conversation, how to find that point of commonality, how to find that point of connection from which you could have the conversation. And I realized there's a lot that we can build on between these political parties. There's a lot of bridges we can build within our range of political ideology in this country. And I said, we can do work together if only we lean into it. You know, I left that White House. No, I ran out of that White House. And when I left, after my year was done, what I realized was that it was time to go home. Come back to Central Virginia. That's where it was time to come home. My wife's from Appomattox County, like I told you. So she's from Appomattox, I'm from Spotsylvania. We said, we're coming back to the part of this country, to the part of this Commonwealth that we call home. You know, and that's important because there's a passion that you've got for home. Yeah. There's a purpose that you have when you're serving the people at home. And we were serving as physicians. My wife, as my daughter says, she's a cooler doctor than I am. She's an emergency doctor. And for my wife, it was powerful coming back. She's the first born and raised Black resident of Appomattox to become a physician. And every time people from Appomattox come to the hospital at the University of Virginia, they know her. They're like, you're Pastor Jones's daughter. You know, that's the power of being at home. But for me, even being in that space, knowing that this is a chance to do some real service, I couldn't shake what I saw in the White House. You see, I'm taking care of folks with diabetes, and I'm seeing food insecurity. Taking care of folks with heart disease, and I'm seeing income inequality or housing instability and the stress that that causes. I'm seeing the fact that health doesn't happen in hospitals and clinics, it happens in communities. And that health is in all policies. And that our policies should create a society that gives people a chance to be healthy. That's what I'm seeing. And that's what sparked that idea that maybe I could be doing more. Maybe I could use my skill set, my experiences, my background, and my passions to serve people in addition to what I'm doing clinically. And the thing that tipped it over, the thing that made me decide I'm running for office, that was this court case that might strike down the entire Affordable Care Act. See, I've seen up close and personal the good that it's done, and I know it's not perfect, but I know we can build upon it. And to tell me the court can make a decision and get rid of the entire law on November 10th, who's going to be there to pick up the pieces? Who's going to be there to build on our healthcare system? Who's going to be there to help make sure that it works? And I was in the White House the day President Trump said, who knew healthcare could be so complicated? I know healthcare could be so complicated. Who's going to be there? And the truth is, sometimes we are the ones we're waiting for. We are the ones. And so I said, that's it. I'm running. 451 days ago, I said, I'm running. And for these last 14 and a half months, it's been going all right. You know, we won a primary that was competitive with 2/3 of the vote. We won in all 21 counties and in both cities here in Virginia Smith. That's how we started this momentum. We galvanized the Democratic Party, but we said it's not just Democrats. There's a lot of independents in this district. Independents are one of the largest voting groups in the 5th Congressional District. And we have to give them something to believe in. It's not about party, it's about people. And so then reaching out and having those conversations every single day, saying, here's what I aim to do, here's how I aim to help, here's how I want to serve. That's why I'm here. And it went from a likely Republican seat in May to a leans Republican seat in June to a toss-up race in September to a toss-up leaning Democratic right now because we are going to win this race. Those polls alone, they won't do it. We've had 7 straight polls that show that we pulled into the lead, but that won't do it. What's going to do it is showing up. Polls don't vote, people do. And so for each and every one of you, again, raise your hands if you've already voted. Look at that. Look around. And then think about who's not here. Because we win this race by how well we connect with those people who aren't here. That's how we win this race. That's how we share these ideas. That's how we share this philosophy that everyone should have access, opportunities for health and success. That's how we share this philosophy that we should be putting people over politics, that we should have a strong and passionate and capable voice in Washington that speaks for us. That's how we do it. One person at a time. So for each of you, there are 3 things that you're supposed to remember about me, right? Number 1 is that I'm a consensus builder. Number 2 is I'm passionate about
Equity and justice.
Equity and justice. And finally, I'm always about that action. That's right. And I want you to go out and share that message and tell that story. I want you to think about your friends, your neighbors, your coworkers, your relatives, anybody you can find, and say, have you voted yet? You don't even have to tell them who to vote for, although you should. You just have to tell them to vote. Because what we know is this is a contest of ideas. And we've got the better ideas. This is a contest of character, of passion, of experience, and we've got that. And so when it comes down to it, you tell them to vote. And when we vote, we win. I said when we vote, I said when we vote. That's right, because this year, this district doesn't flip every year. 20 years, one time a Democrat has won. In 20 years. But we're going to win this time. We're going to win because of the work you're going to do for the next 3 days. We're going to win because you're going to count the people you're going to reach out to, and then you're going to go one step farther. We're going to win because we believe it, because we visualize it, because we know this is the moment. You can choose a lot of things in politics, but you can't choose your moment. And in the moment when we have a global health pandemic and a national crisis of racial injustice, we need a doctor who's passionate about healing. We need somebody who knows about fighting for social justice. We need somebody from this district who knows this district, who's going to serve